Now there are people who are coming.
Okay. Hi, I'm Dr. Dharini Krishnan, consultant dietitian from Chennai. I'm here to talk to you about pregnancy, diet mainly, and a little bit about lifestyle in pregnancy. Now, it's very important to follow nutrition. Nutrition is a very important aspect of total life and very, very important during pregnancy. Nutrition is what feeds in all that you need for your little one to grow. And today we are hosting a webinar because webinar is the way forward today in social media, where we can reach a lot of people, seen by people even after the live show today. So that is why this webinar is being hosted. Now coming to pregnancy, pregnancy spans for 9 months and 1 week. Normally in vernacular, they say it's full 10 months. That's not true. It's just 9 months and 1 week. So that's why pregnancy is divided into 3 trimesters, where 3 months each. One trimester is 3 months. Before the lady is actually found out to be pregnant, it is already 40 days, which means about 1/3 of the first trimester is over. And usually till 90 days, the lady is always nausea and vomiting. So nothing to worry. The first 3 months is taken care by nature, where the ovum of the child itself provides the nutrients that is needed for them. So even if the lady eats very little, there's nothing to worry. The first 90 days, we don't have to worry about the nutrition of the mother. But definitely, whenever possible, she should be able to eat and should eat good food which has protein, which has iron and calcium. Then we move on to the second trimester, where from the 4th month to the 6th month. This is very important because before 90 days, the baby is formed in its minuscule size for everything. And from there on, the baby is becoming bigger and the organs are being formed. So normal food, we need about 1 gram of protein. So around 50 to 55 grams of protein is what we need per day. But during pregnancy, that is the 2nd and 3rd trimester, that is 4th to 9th month, we need an extra 20 to 23 grams of protein. So around 75 to 78 grams of protein is needed by this person. We need a lot of calcium because calcium, normally we need about 600 milligrams per day. But during pregnancy, you need 1 gram of calcium per day. And iron, we need about 23 milligrams of iron. When we look at the total food pattern, we need to eat very healthy. Today, with working parents, sometimes mothers are not, the to-be mothers are not thinking about their body at all. So whenever you feel hungry, you must eat something which is healthy. So you can start your day early morning with a cup of milk. Even if you want to have coffee or tea, it should have a lot of milk and very little coffee or tea. And then you move on to breakfast. You should not skip breakfast because those sometimes who are working late and get up early just enough to leave to work tend to miss breakfast. This is not a good idea at all for even normal people. So those who are pregnant definitely should have a proper breakfast. And breakfast should contain grain, which is idli, dosa, or dokla, or paratha, or whatever the traditional food is, which is basically one food group, which is grain. And then should have a protein part, if possible, like sambar or dal, or a little bit of sprouts. And then you can also have a fruit. And definitely a glass of milk at breakfast or at 11 o'clock. Now, what you add to the milk should not be high sugar. It should be less sugar, but it can be any flavor. It doesn't matter. Then we move on to lunch, where you should have at least 2 rotis or 1 cup of rice. And you should have enough protein in the diet. Because though we say that normal people need about 55 grams of protein, in India, people are eating only 20 to 22 grams of protein per day. So in pregnancy, when you need that extra 20 plus grams, you have to be very careful that you eat about a cup of dal, a thick dal. When I say a cup, I mean 200 ml is 1 cup. So you need a cup of dal or its equivalent as fish or chicken or any of the seafood that you are eating. So this will give you a good 8 to 10 grams of protein. And then you move on to having vegetables. So when we talk about vegetables, we're looking at dark green leafy vegetables. The 16 types of dark green vegetables which are available in our country, which we know how to use either as a dry vegetable or as a gravy, or we can even put it into our rotis like methi roti, or we put it in our drumstick leaves in our adai and things like that. So we know how to add it in different forms, so we can use that. Even curry leaves is very, very important. Calcium, fiber, and iron. So, and a little bit of protein. So anything dark green can be used. Plus, you can move from the darkest green to the lightest green of vegetables. In today's scenario, the most neglected food group is vegetables. So during pregnancy, you have to definitely focus on eating at least half to three-fourth cup of vegetable, either green or orange or red in color. And definitely a green vegetable, either as the dark green leafy vegetable or a beans or a watery vegetable or the gourds as we call. So these are very, very important. And then you can add on with the orange and red, which is the carrot and the tomato. The fourth, so we're done with grains, we're done with protein, the second food group. The third is vegetables. And the fourth, during lunch and dinner, would be dairy. So normal people, we say 300 to 400 ml of milk you need a day. But during pregnancy, you need to increase the quantity of milk, and you have to go up to 600 to 700 ml of, depending on which month of pregnancy you are in. This can be milk in coffee, milk in tea. It could be milk in your porridge. Suppose you're taking a multigrain porridge, or if you're taking oats or whatever you're taking. So the milk can be added to that, or it can be curd. So the 600 to 700 ml of milk can be either as milk or as curd, which is count of all the milk that you take in your coffee, your tea, your curd, your buttermilk, or in the porridge, or even if when you make like out of buttermilk products like kadhi, or you make more korma like down south. So things like that. So whatever it is, we need the milk because the milk will give the extra calcium that we need. And if we are vegetarian, this is doubly important because we get bioavailable calcium only from milk in a vegetarian diet. Then we move on to what is the fruits. So we need in between meals also as we move into pregnancy from the 4th month onwards. It's very important to have 11 o'clock and a 3 o'clock snack because definitely there will be hunger. So all we need to take is maybe a handful of nuts, or you can make a porridge, multi-grain, which has 3 or 4 grains such as ragi, jowar, bajra, and dals, 4 or 5 types of dals. So this way it adds on protein and it adds fiber and it adds calcium. Like if you take ragi itself, it is very rich in protein, fiber, iron, and calcium. So you need to take as much as millets like ragi, samai, varagu, bajra, jowar, wherever possible. You can add it to your regular meals along with the rice, or you can make flowers and add it to the rotis that you're making, or you can also use it instead of rice, or when you make a pongal or a khichdi. These things can be used very carefully. Now, what is the advantage of millets? They have protein much more than rice, because in the rice, because we mill it, it does not give us the extra protein. But if you're using red rice or yellow rice, which is partly milled rice, then automatically you're getting some amount of protein and fiber. But in the millets, just like wheat, it's totally intact. So you can eat, which will give you protein plus fiber along with the normal nutrients that are there in rice. Now then after that, the 3 o'clock meal you can have your coffee or tea, and 6 o'clock meal can be a fruit. Always it is better to have a fruit as a fruit instead of a juice. Because when you take it as a juice, let's take an example of sweet lime. When we make it as a juice, automatically the most important nutrient that goes out of the system is the fiber. And you need fiber. This will help prevent constipation. So that is why you have to have the fruit as a fruit, the vegetable as a vegetable, because you need to bite into it, and that's important. But once in a way, you can have a soup or a juice. But the problem is never have these things outside, because the hygiene is a big issue, and how long before they did it, before giving it to you. And too much sugar is added if the juices are taken outside. Now, those who take juices out of regular packeted forms, it is safe and hygiene, but usually there is mix of juices and hence the glycemic index is higher. Today, if you take in India, it's a common and it's become a regulation to test your blood sugar very early in pregnancy and on to the 3rd month and so on. The reason is gestational diabetes during pregnancy is it's coming up. The numbers are going up. Whether the mother is thin or whether the mother is fat or whether the mother is from whatever strata of society, there are a lot of problems. So you have to take those tests. Now you're also prescribed regular supplements from the doctor, the gynecologist. You should not say that I know better than the doctor and not take these supplements. Because the most important supplement they give is folic acid. In fact, they say if you're planning your pregnancy, it is better to take folic acid 2 to 3 months before you get pregnant. Because this is a very, very major nutrient which decides the mental IQ of the baby, and it helps the neural system become better. So it's very important to have folic acid. Even if you did not do that, during pregnancy, continue to take the supplements as folic acid, iron, calcium, which are provided to you, because it's very important to take them. Because a lot of people today on their own take decisions and do not take these medications, but they're not medicines as like that. They are only nutrients given in a different form. Because through our diet, because we don't take enough of dal, enough of vegetables, we may not be able to reach the required folic acid levels. Now, iron is a very important nutrient. Again, if pregnancy is a planned pregnancy, if you can make sure that your hemoglobin is in normal levels before you get pregnant, that is the best. But if already pregnancy has happened and if your iron levels are low, it's very important for you to correct it. So iron-rich foods would be green leafy vegetables, dates, ragi, which can be used regularly. And if you can make a palak soup or if you can make any kind of green leafy vegetable soup and have it with a little bit of lime juice. That's the best absorption between meals. Because with our meals, there are a lot of oxalates and phytates which interfere with the iron in the food. It does not allow it to get absorbed into the body. So we need to do this carefully. You can take dates also, either an empty stomach or between meals with lime juice, because vitamin C and dates go together very well. In iron absorption. If some people are allergic to lime or cannot take lime juice, then you can have amla along with dates, because the two together, the vitamin C and the iron, will help in absorption. Now, the myths about pregnancy are, first is people think you should not take papaya because it's a hot food, and sorry, you end up getting problems, or the fetus will get aborted. Sorry, but this is not true at all, because papaya in its raw form, if taken as a juice in the first 3 months, that's when the problem can happen. But papaya as a fruit can be taken throughout. But in our country, because of the myth that's attached, people get very worried. But definitely you can take it after 90 days, because it's a very rich source of beta carotene, and it's very good for you to take papaya. Coming to any seasonal fruit, this can be had during pregnancy, whether it's oranges or lime or watermelon or guava or chiku, whatever the fruit. Only thing, don't overdo the fruit in case you have borderline sugar levels. You can have 2 cups of fruit, no problem at all, but don't overdo them. Like, for example, during mango season, you don't want to have a big mango, for example, a Banganapalli mango. You don't want to polish it off, and you don't want to have it twice a day. Definitely not. You want to go for half a slice, one side of the mango, twice. That can be had. It can be had with other fruits. Now, coming to dry fruits, badam, walnuts, sunflower seeds, raisins, figs, and dates, everything can be had regularly. Now, the mother does not have to think that pregnancy is something like a disease. It's a very normal physiological process. You can be very normal, you can continue to do all that you're doing, but you have to take your food and meals at regular times. You have to concentrate on protein, calcium, iron. Now, coming to exercise. It's very good for the mother to exercise right from the beginning of pregnancy, unless there is a doctor advice for bed rest. Otherwise, a short walk of 40 minutes, 30 minutes, 45 minutes is very, very good, because it keeps flexibility there and it maintains your sugar levels, it helps in your digestion and everything. So definite, you should take a walk. Even if you do it within your home or on your terrace, even that is fine, but you have to go for a 30 to 45-minute walk. There are trained people who give you extremely good yogic poses, which helps in labor. So if you do have people like that, you can try. Also, who teach you what is the right posture. Like they tell you right from the beginning, never cross your legs. Never, even when you sleep, try to cross your legs too often, because this can lead to the umbilical cord being twisting around the baby. So how true this is, whether there are clinical studies, I'm not sure, but definitely what traditional people say have a lot of meaning. Now, coming to de-stressing, because women are multitasking, there is a lot of stress in the system, and any stress of the mother will be passed on to the baby. So definitely you need to de-stress. Any form of de-stress, you could do deep breathing, you could do yoga, you could do om chanting, or whatever syllable, it doesn't matter. You could chant that syllable, or even think about nature. You could think of a dancing peacock. Just close your eyes and think about it. Anything that brings happiness to you, that's very, very important. In traditional systems, they used to ask a pregnant mother to listen to classical music. That's important, not the rock or not the current music, which is all, lot of wrong vibrations. You should go to the classical music, which is the right vibrations for the baby and the mother. So this way we can definitely help. So we have some questions here where they say whether amniotic fluid is low, take fluids, but it is still low. So should I go for drips? Please advise. See, this a doctor should advise, a gynecologist. I am as a dietitian cannot advise you this, but whatever they say, if you have to take the fluids, you continue to take it and it will help. But whether you should go for drips, it's only a doctor, a gynecologist should advise and not me. Lose weight fast. Is she pregnant? Is she a new mother? See, losing weight fast is not good for anybody. And during pregnancy, you do not want to lose weight. This is very, very important because you need to put on weight. You need to put on around 12 to 16 kilos or maximum 18 kilos during the total span of pregnancy. So at this time, you're not going to go on losing weight diet, but you will go on a high calorie diet, like having a lot of maida products, baked products, puff products. These you will stop having, but you will have healthy foods like what we have already explained, good protein foods, good calcium food, which will help the growth of the baby. Now in 8-month pregnancy, sugar level is 134. Please advise what food should she take, sugar content in food and diabetes control. If sugar level is 134, first, is it fasting or PP? I don't know. If it is fasting, definitely you have to watch it because it's high for pregnancy. And in pregnancy, it's very important to maintain your fasting below 100 and PP below 140. Because if it goes above this, it can affect the baby and you don't want a bigger baby, microsomia we call it, where the baby is bigger, overweight, and all the organs also become bigger. So you first need to clarify that you definitely
She's saying it's fasting.
fasting. Yeah. So then you need to definitely take a lot of vegetables at night. Take all the medications that people are advising you regularly because a lot of people don't take the medications. They've been advised to take, even if you have to take insulin, if the doctor asks you to take insulin, please take it because that will maintain your sugars and that will help your baby grow properly. So you need to do that and you need to concentrate on having a lot of vegetables. If you're having about 1 cup of rice, you must have 2 cups of vegetable and the vegetable should be green or orange or red in color. Yeah. So bananas 3 to 4 days, 3 to 4 bananas a day, that is too much. You can have 1 or maximum 2 if it's a very small banana like a hill plantain or a yelaki, that is the Bangalore rastali. You can have 2, but otherwise 1 is more than enough. Yeah. 5 months pregnant. Yeah, but my doctor has prescribed me protein supplement. I'm a vegetarian. Take 2 glasses of milk a day. Please advise. See, you can take protein supplement also, but you can take milk as milk 2 glasses, but on a total, as I advise, 600 to, you can have 500 to 600 ml of milk because you're just in 5 months and slowly you can build it to 700 ml, either as milk or curd or whatever. So the total milk in your coffee, tea and curd can go up to 500 ml. Is it fine to have cold juices or milk? It is. Will it harm the baby? Cold juices will not harm the baby, but cold juices can spike your sugar. So that is why fruit is better. You can cut a fresh watermelon or keep it in the fridge and have, nothing will happen. Cold milk is fine, nothing will happen to you. Are foods like kakra, soy chakli and other food during 6 months of pregnancy? That's fine, but don't buy too much of food outside. Like a kakra, if you're making it at home, it's wonderful because the bought and packaged kakra is full of salt. The salt is too much and it can increase your blood pressure. So that is why if you can make it with less salt, that's fine. Soy chakli, again, if it's made the right way, if the fat, it doesn't have trans fats, problem. Grapes and chiku and mango in small quantities, fine. But if your blood sugar is high, then definitely you have to avoid all three: grapes, mango, and chiku, or have very little quantity, 1 or 2 pieces, it's fine. Can we have rice idli in case of gestational diabetes? Yes, you can have rice idli, but in the same meal, you need to take a guava, or you need to take a little bit of a low glycemic fruit like guava, then you can have pear, things like this. But the best would be that you do 50% rice and 50% you can do bajra and make idli at home, and that will help you control your sugar. I have my placenta 4 centimeters from the cervix. Can it be called low-lying placenta? Can I do yogic exercises in this condition? I am a dietitian. I am not a doctor. So you please consult your doctor for the same. I'm in 4 months pregnant. I wanted to know that is eating less a problem for the baby? Yeah, you're 4 months pregnant. You must start eating properly. Even if you eat less, you must eat properly the all meals. Like you should have a breakfast, you should have 11 o'clock snack, you should have a lunch, you should have a 3 o'clock snack, and you should have dinner. You should not skip meals, but slowly you can increase the quantity as you go. I'm 9 months in pregnancy. Can I have avocado fruit? You can very well have avocado, no problem at all. If you're 9 months, towards the end of 9 months, then anything you have is not going to really help because you just have a week or more towards delivery. But if you're in early 9 months, yes, you can have a little more protein to help the baby grow. If carrots are not available, what can be the substitute? You can take papaya because carrots and papaya have beta carotene and it will help. My wife has 5 months pregnancy. Her weight is 76. Is it okay? See, I don't know her starting weight, so I don't know. I cannot comment on this. But basically, through pregnancy, the first 4 months, you won't put on too much weight, nothing to worry. From the 5th month, you will start putting on weight. I'm planning for pregnancy. What is the most important nutrition for me? Then folic acid. Check out your hemoglobin. It is normal. So then take enough iron to make your hemoglobin right and keep your B12, folic acid and hemoglobin in correct numbers. Are oils and fats part of a healthy diet? Yes, you are allowed 15 to 20 ml of oil per day, in which you can have a little ghee. You can have basically your traditional oil, whether it's gingerly oil or mustard oil, and you can have olive oil or anything if you need. That's not necessary, but you can have traditional oil, a little bit of sunflower oil, and a little bit of ghee. My weight didn't increase from the last 3 months. Is it fine? I'm in 7.5 months of pregnancy. You have to definitely watch out because you have to increase weight from the 5th month. Please contact your gynecologist. Maybe you're not eating properly. You need to take a step back if you're working, or even if you're not working, start eating properly in each meal. That's very important. Can we sleep on our back or should we sleep on the left side? We prefer to sleep on the left side because that's the best way the blood reaches the baby, the fetus. But once in a way you can sleep on your back. It's not a problem. My wife is 5 months pregnant. Her weight is 76. Her starting weight is 62. She's good. No problem at all. She's perfectly all right. Let her continue. In fact, she doesn't have to put on so much weight. You can go slow. I was 62 when I conceived. Now I weigh 68. Is it healthy weight? Which month? Swati needs to reply for us to comment. What kind of pulses are good to consume? All pulses are good. If you have a digestion issue, green gram is the best, green gram dal. Otherwise, tur dal, green gram dal can be used. And twice or thrice a week, you can use chana, rajma, cowpea, green gram, everything. I'm 5 months pregnant. Saffron milk is totally necessary during pregnancy. It's not necessary at all, but saffron has a huge antioxidant. If you're having saffron to have a fair baby, it's not true at all. It's a myth. But saffron is a very good antioxidant. You can take it. That's not a problem. I've completed 5th month. I was 62 when I conceived. Now I'm 68.2. No problem at all. You can slowly keep eating. You will be better. No problem. You're going good. There's no problem at all. What to eat after 5th month? You eat a normal diet, concentrate on protein, vegetables, fruits, high calcium. So milk is very important. Paneer, and you homemade paneer, and you can have curd also. Can we have Chinese food from outside without Ajinomoto? You cannot be sure when you eat outside that there is no Ajinomoto. But anyway, once in a way, eating anything is not a problem at all. What is the remedy for heartburn? That means you're giving lot of gaps between meals. You should eat properly at the right time. And overnight, if you're getting heartburn early in the morning, just before sleeping, you can have a fruit, either a banana or an apple or a pear. You can have that, will sort it out. I'm 8 months pregnant and having 8.8 and sugar is 144, HB 8.8. What should I do? Has your gynecologist advised any iron tablets? Please take it. Folic acid also, because these two can prevent prevent anemia. And sugar, if fasting is 144, then you need to have more vegetable at dinner, and you need to work with your gynecologist to bring down the sugar. Whether it's medication or insulin, you need to work with them. And sometimes face difficulty in breathing, 7.5 months. This is not a problem. You just need to raise your, make a one pillow, keep a little higher. Your head should be a little higher, need not be 2 pillows. It can be a smaller pillow. So that will help you in the breathing part. But check your hemoglobin in case that could be the reason for But when are you having breathing difficulty? Is it after a meal or what? You let me know. Should there be between 2 meals? Don't worry about it. Normal breakfast, lunch and dinner time only. 4 hours difference. If you feel hungry in between, you can take a snack. I'm 31 weeks, starting weight is 59. I take type 2 diabetes, insulin now. My weight is 63.7. Is it okay? Yeah, it's fine. Not a problem. I'm 6 months into pregnancy. Sometimes I have chest pain during pregnancy. Is it normal? Yeah, it's fine. Not a problem. You can have some jeera pani and you will be fine. So I think we'll start winding up this session. We are almost done. You can all post your questions and we will answer later, or you contact the people. And thank you so much for being part of this live session. We're very happy to have answered whatever questions we could take. Thank you very much.